Hello everyone, I'm going to be doing my presentation on ovarian cancer. So first off, just some general information about ovarian cancer. Um, it occurs when cancerous cells are found near, inside, or on the surface of the ovaries. Ovaries are the organs near the uterus that store the eggs and produce female hormones, progesterone, and estrogen. Cancer develops when abnormal cells grow uncontrollably. This often results in the growth of tumors, and these tumors can press on surrounding organs that are near the ovaries. Cancer cells can also migrate to other parts of the body and affect those parts, and that's when the cancer becomes more deadly. So this disease is relatively rare. It affects 1 in 78 women. It's seen most commonly in women ages 35 to 74, and it's the fifth leading cause of cancer-related death in women. So now I'm going to talk a little bit about detection and the prognosis of this disease. It varies based on the individual and the stage of cancer that it is. When it's detected at stage 1 or 2, the 5-year survival rate is relatively high. But when it's detected at stages 3 or 4, the survival rate is much lower, around 28%. The detection is quite difficult at early stages, so most cases are not diagnosed in stages 1 or 2. You can see in this picture that I included, it's uh, when it's diagnosed in the first 2 stages, there's a much higher chance of survival from this cancer. So some common symptoms include bloating, constipation, upset stomach, pelvic or abdominal pain, low appetite, urinary urgency, fatigue, and changes in period. For the diagnosis of this disease, it's very important to get regular pelvic exams. Unfortunately, many early tumors are undetectable during a pelvic exam. However, they still can be detected at early stages. And another way of diagnosing this disease can be through screening tests if the patient is experiencing symptoms. While the screening tests are not always reliable for ovarian cancer, current research is looking into better ways to detect it earlier. The screenings are even more important for those that are at a higher risk, such as those with a family history of ovarian cancer. And then as far as treatments for ovarian cancer, there is surgery, chemotherapy, clinical trials, systemic treatments, and hormone therapies. While there are many different treatments for this kind of cancer, it's very individualized based on the stage of the patient and the age of the patient, and depending on what they want to do to treat their cancer and what their doctors recommend. And lastly, I'll talk about if other species can get ovarian cancer. So most other mammals and birds can get ovarian cancer because they have ovaries, and it has been reported in livestock and pets. However, it's more common in pets that are not spayed because they continue to have a menstrual cycle and continue to produce hormones, which can increase their chances of getting ovarian cancer.